What is agoraphobia? When we speak of agoraphobia, many people think of the fear of public spaces. But did you know that agoraphobia can apply to many different situations? Hello, I'm Sreela Roy-Greene, PhD, LMHC, and today we're exploring what agoraphobia is, how it can manifest, as well as how to address this phobia. You may wonder, what is agoraphobia like? Now imagine that your friend is terrified of subway stations. When their colleague suggests taking the subway home, they start to tremble, sweat, and their heart begins to race. What if something happens at the station and there's no one to help? The thought of being trapped and unable to escape is so intense that they'll do anything to avoid it, even if not taking the subway adds another hour to their commute. For them, leaving the house to go to work is already a major challenge. This may mean that your friend has agoraphobia. Now, let's explore agoraphobia more thoroughly. What is agoraphobia? Agoraphobia is an anxiety disorder characterized by a fear of being in specific places or situations. While many people think of it as a fear of open spaces, agoraphobia tends to be a much broader phobia. Any situation that a person finds unsettling or unsafe may lead to agoraphobia in some individuals. For some, this phobia can be quite debilitating, as a person may severely restrict their lives to avoid exposing themselves to the feared situation. The American Psychiatric Association defines agoraphobia as an anxiety disorder that causes an intense fear of becoming overwhelmed or unable to escape or get help. The intensity of the fear may lead a person to avoid triggering situations. They may also avoid new or unfamiliar situations that may instill a similar fear. A person may avoid enclosed spaces such as subways or elevators, being out of their home alone, crowded public spaces such as parks, public markets, or city streets, open spaces such as festivals, beaches, or arenas. It's also common for someone with agoraphobia to experience a panic attack when faced with certain situations. Imagining the feared situation can also provoke a panic attack. Agoraphobia, anxiety, and panic disorder. While agoraphobia is characterized as an anxiety disorder, many people with agoraphobia also have panic disorder. Panic disorder is also an anxiety disorder that involves recurrent panic attacks that can happen suddenly. A person with agoraphobia and panic disorder may fear having a panic attack. For example, a person who has had a panic attack can worry about having another one. This may lead them to want to avoid exposing themselves to a situation that may cause it. For example, if a person experiences a panic attack in a subway station, they may fear having another one there or in similar places. This may explain how panic disorder and agoraphobia can be connected. Findings show that panic disorder and agoraphobia co-occur in at least a third of these cases. When agoraphobia goes unaddressed, the condition can cause many people to severely restrict their lives, as well as reducing one's quality of life. Agoraphobia can impact a person's relationships, career, physical health, and well-being. Symptoms of agoraphobia. The main symptom of agoraphobia is a disproportionate level of fear about a situation. These situations can make one feel exposed, unsettled, or unable to leave easily. While having any kind of phobia may lead one to avoid potentially triggering situations, the broad scope of agoraphobia can be severely limiting. Many people go to great lengths to avoid feared situations. It's also not uncommon to experience moderate to extreme anxiety around mundane activities, such as going to work or grocery shopping. And if one must endure it, such as having to go to the store, they may ask someone to accompany them or go alone, but experience significant anxiety. Some individuals stop leaving their home. A person may also avoid activities like going outside to get the mail or take out the trash. As a result, one may become increasingly dependent on others. Typically, to qualify as clinical agoraphobia, symptoms of agoraphobia must last at least 6 months and significantly disrupt one's life. Usually, this phobia manifests in adolescence or by the time someone reaches the age of 35. Since agoraphobia often accompanies panic disorder, it might be helpful to know the common signs of a panic attack. Signs of a panic attack include a sense of losing control, a sense of impending doom, rapid heart rate, shaking or trembling, difficulty breathing, dizziness, upset stomach, numbness or tingling in the hands, sweating, fear of having another panic attack. While panic attacks don't usually last long, they can cause strong mental and physical symptoms, so much so that they are often confused with heart attacks. These attacks can also be scary, so it's understandable to want to do everything possible to avoid them. However, avoidance can make things worse, so therapy usually involves tackling avoidance. In what ways do you think a phobia can impact a person's life? Please share your thoughts in the comments. You can also subscribe and enable notifications to receive more information on mental health. Treatment for agoraphobia. When we speak of treatment for agoraphobia, it usually involves some form of psychotherapy. Psychotherapy is a form of talk therapy, and there are many modalities within it. Cognitive behavioral therapy, which is commonly known as CBT, is one of the most widely accepted approaches to address phobias, such as agoraphobia. With CBT, a therapist seeks to help the individual identify and challenge their habitual thought patterns. By learning to shift thought patterns around their triggers, they can begin to develop healthy coping mechanisms. These coping mechanisms can allow them to manage symptoms when they arise. A person may also be encouraged and supported while working to face their triggers. This process usually involves some form of exposure therapy. In some cases, medication may also be recommended. These are usually antidepressants or anti-anxiety medications. Medication should only be prescribed by a medical professional who is aware of a person's medical history. Other ways to treat agoraphobia. One significant challenge with treating agoraphobia is that many people with the condition find it difficult to leave the house. This can make in-person therapy uncomfortable or even impossible, depending on the situation. In these cases, online therapy may be a viable treatment option. Online therapy allows a person to have sessions with a licensed therapist from the comfort of their own home. This may allow a person to address challenges gradually, adhering to the principles of exposure therapy without being an initial barrier to treatment. Tips for agoraphobia. While living with agoraphobia can be challenging, there are many effective ways to relieve symptoms. Developing coping strategies can also help a person integrate the practices introduced in therapy. Some helpful ways to manage agoraphobia include doing deep breathing exercises, wearing headphones in public spaces, and practicing muscle relaxation techniques. It may also be helpful to focus on something concrete when you're in a situation that may cause anxiety, such as reading labels on items at the store or the announcements on the subway. Bringing a book to read or drawing in a journal while taking transportation or going to a cafe may also alleviate anxiety. Additional tools include reducing stimulants such as caffeine and coffee, practicing mindfulness, getting quality sleep, eating a healthy diet, avoiding alcohol and other substances, exercising regularly. But what does one do when they have an anxiety attack? First, remember that while the experience may be frightening, it's not dangerous. Don't try to fight the experience. Instead, allow it to come and go. You can visualize a scene that brings you a sense of peace, for example. This is known as creative visualization. It's also important to celebrate small successes, such as approaching a subway station. Also, remember that some days and times can be easier than others. At each time one manages to face their fear in small ways, they may be closer to overcoming it. Do you have any other strategies for managing agoraphobia? We'd love to hear it in the comments. Finally, if you believe that someone you know has this phobia, consider sending them this video. If you'd like more information and additional tips about anxiety-related symptoms, click here to watch another video. It's titled, "How Can I Relieve My Anxiety? Coping Strategies for Fast Relief." Also, thanks for watching. While agoraphobia may be very challenging at times, there are many helpful ways to address symptoms. If you found this video helpful, please like it and subscribe to our channel.